Welcome back, dear viewers, and our guest this evening is Dr. Alkhawari, Director of Child Protection Office at the Ministry of Health. Dr. Muna, good evening, and it's really a pleasure to have you with us on the Hala Kuwait.
It's my pleasure, sir.
It's really a pleasure. So we're really wondering about the motivation, or what motivated the Ministry of Health to establish the Supreme National Committee for Child Protection, or Protection of Children, in the year 2013.
Yeah, actually, for a while there is, many cases we are facing for children coming with violence from their guardian, from their parents, and that time there wasn't any clear protocols or procedures what to do for that child. Even reporting, so people didn't know where to report and where to go, what the services available. So from that, and myself as I'm a doctor, so I'm facing these children, and what we are doing just to give them the medication, the management, and send them back home where they can have a re-traumatized or re-violence.
Great plan.
So the idea came from that, that we need to do create a system in Kuwait. However, that it wouldn't be only from Ministry of Health. It should be in the multi-sectoral. It should be all sectors, because that condition, which is child maltreatment or child abuse and neglect, it is not a matter of one sector. All sectors have to collaborate to give the services for the child. And from that point of view, we propose to Ministry of Health that we need to have this committee to have a brainstorming, to think together what to do and how we build up this system.
Well, that's great, and it provides children protection, which is really needed for children, Doctor. And how does the national, or the Supreme National Committee, collaborate with other ministries and non-governmental organizations to protect children?
Right.
Tell us more about the collaborations, please.
Actually, it is, the principles of dealing with children, child maltreated, and the principles of the child protection is to work together, and to have the multi-sectoral, that from government and non-government. As I said, the Ministry of Health has a role, Ministry of Education, Ministry of Interior, and all sectors that dealing with that child has a role and responsibilities to provide the service for survivors of violence. And the idea of that committee came that we bring up all related sectors and all members that working together, and we accomplished a lot actually through that committees. The main two important things that we create a channel between Ministry of Health, and by creating the Child Protection Office, and Ministry of Interior, where the investigations and the legal procedures to be proceeded over there by creating the Child Protection Department. And of course, there are other sectors are collaborating with different services that we needed, like for shelters, for putting reporting system, how people they can report. We create actually a clear methodology and a clear procedures for public and professionals how to get to contact to us. And this is by having the child helpline, which is 147, where everybody can report any case or any child that witness with violence through that helpline, and then we take the responsibility and to proceed for whatever the services needed for this child.
Well, that's really great and promising, Doctor. And we're wondering also about the aim to achieve something most of the specific goals, or
of course
we're wondering about the specific goals or does the National Supreme Committee aim to achieve when it comes to terms of child protection?
The goals, actually, it is the key element of any child protection system, where it is the legal procedures, implementation of this legal procedure, having a child law within the country. It is important, or one of the main goals. Providing services, and the services not only the services of responding to any child with child maltreated, however, to provide services for prevention and putting a program to prevent that event from happening. Of course, the training of and increased capacity of the manpower that working within the child protection, having a prevention program, awareness of the community. It is one of goals, because we have to raise the awareness toward the child rights, where the CRC or the United Nations have a treaty that committed by Kuwait to protect it. So these child rights, we have to increase the awareness of the parents and public towards these things. So there are many actually, but the main thing is implementation of the law, providing the services, the prevention program, the awareness, training and increasing capacity, and of course monitoring all of this together.
As always the doctors mention, prevention is better than treatment, which is really
That's
a great goal and something great to do before any problem can happen. So how about child protection, doctor, and the child protection teams in governmental hospitals, and how do they operate under the guidance of the child protection office? Do you contact with them? Do you have communication plans with each other?
Actually, this is the core of the case management. So the case management is taken by the child protection office, and we create these child protection teams, and we distribute it all over the nation in the different governors. So we have 6 governors and 7 hospitals, and in each general hospitals there is a team. It is a multidisciplinary team. So there is a doctors, the nurses, the social workers, the psychologists, and we are lucky enough to have the forensic medicine also specialists in the team. Presence of these child protection teams within the governors and within these hospitals make it very easier for us to refer the child to the child protection team within the hospital. So a place that it's known for the parents, for the child, is not something that, and it is in one place. I mean, the child hasn't, we will prevent him from going from one sector to another. I mean, to the police officers or to the prosecutors or to the law, to the judge actually. By bringing the services around the child in one place, prevent the re-traumatizing of that child from repeating, the same history, the same story. So the child is really, we need
more light on the child.
Exactly, it's very vulnerable, and we need to provide a protection from even the professionals, from those workers. So this is coming the idea why we have these teams in different hospitals. And of course, with the flow is coming through the 147 and helpline, where we create an electronic system, and from that electronic system we'll create the file, and of course that to increase our confidentiality and privacy for the child complaint, the parents, and for everyone dealing with these complaints. And then it will refer accordingly, by after triaging and filtering, and according to severity of the case, it will be referred to these teams, and those teams will call the parents and sat with the child. Of course, there will be a clinical interview for the child himself, so they can export all information from the child himself without any other
interference.
Other things that affected.
Well, that's really an important point you just mentioned, doctor. It will lead us to ask you about the responsibilities of the Child Protection Office and the Ministry of Health. Tell us more about the main responsibilities of the office.
Well, the main responsibilities of actually our hierarchy, it's basically we have 8 units. The first important one, which is dealing with these cases. So we are, following any child maltreated case and tracking to ensure that the child received his services. And this is the following up of the child protection teams. The other one is the following or ensuring the 147, the child helpline, that is working with the best quality. The awareness unit, and we have the prevention program unit and training, of course, unit, where there's training. It is a continuous process, not only for those workers within the child protection office, but for all professionals. I mean, from health providers to educators to social affairs, so everybody, prosecutors, we are providing training for everyone.
Well, that's great. I believe our viewers wondering about the in cases how the Child Protection Office deals with the different children and cases. They're wondering, and we're all wondering about how the office ensures the privacy and care of children when it comes to the cases and the case management.
Yeah, actually the confidentiality and privacy is a very important goal for us. It is for everything. The confidentiality is there, not only for the child but even for the workers. So by creating that electronic system within a closed circle, it is just between the Child Protection Office and the teams and those working, that will give us that increase actually the privacy and the confidentiality. And of course we are not breaking any reporter like identity. That is very important. And of course the reporter, it will be he is protected, or she is protected by the law actually, because there is an article that protects any reporter. So we are not breaking any identity of that reporter, and that help us even, you know, encouraging people to report more. And of course all workers, they have to sign like agreement not to break any of these confidentiality and privacy, as long as they are working within the Child Protection Office, and even afterward, or otherwise there will be a penalty for that.
It can be a penalty. So about the procedures, like procedures and involvement in evaluation, like involved in the evaluation and intervention of child maltreatment or anything related to it. How it can be the evaluation criteria or the cases, how it can be evaluated?
As I mentioned, the child protection of teams, they have certain like procedures. So they call the parents to bring the child in, and because they have different this speciality, so the physician will take care of the physical like assessment or health assessment. The social workers will take care of the social background and indicate if there is any high risk factors, because this is very important. So they will tell us whether this child is safe to go back home or we have to remove him from house and from home. The clinical psychologist is actually the core of the team, because they are sitting with the child and exporting all the information needed for that complaint or that violence. And of course they have many tools, because as children it's difficult, just to ask question and answer it. So they have tools of drawing or asking by anatomical dolls, the house pretending, if there is anything that can indicate within the house had happened. So children really through play, through drawing, through acting, they can export our information. Right.
Exactly, doctor. And we'll be back with a lot of comes to child protection, but we'll have a break. So the viewers, we have a report to you, then we'll be back with our guests. Stay with us. Welcome back, dear viewers, and we're back with our guest this evening, Dr. Alkhawari, Director of Child Protection Office at the Ministry of Health. Welcome back, Doctor, and such valuable information you're sharing with us this evening when it comes to the subject. It's really important subject of child protection. So we are still wondering about the Child Protection Office and monitoring and studying the causes of child abuse. What can you tell us about it, Doctor?
Yeah, of course. We, at the time, before the era of starting that system, we haven't got any data that tell us how much is the problem or how much is the condition in Kuwait. Actually, it was only 16 reports that was in 2000, around 2000. However, from 2010, 2014, we received cases, just those who coming into the emergency room, and that was around 26 to 40 cases. With starting the system and encouraging people to report, especially after issuing the child protection law, the reports become higher and higher. So that increased from like 100 in 2014 until 1,000 plus in 2024. How we can receive these cases? Through two resources. the main resource, which is 147. So everyone can contact us through the hotline, helpline, 147. Anybody can call us, either like from professionals, from health provider, basically, because we are within Ministry of Health, but other professionals, from educator, from social affairs, from nursing, anyone can call us and provide us with this information, all by individuals. So the parents, maybe one of the parents can call us if the child is abused by the other offensive caregiver, or relatives, uncles, or grandpa, grandma, the child peers, the child sibling, the child himself, they can call us. So anybody, neighbors, sometimes we are receiving many calls from neighbors. Sometimes they call us that there is, you know, another apartment or another house, they are witnessing us and like a neglect on the children on this house. So this is one resource, but the second, the official resource, which is from the directly receiving letters from the prosecutors or the court or the investigators, where they ask the Child Protection Office for assessment of that case to taking care of the case, the court case.
Sometimes, doctor, also when it comes to the parents and let's say the guardians, the teachers at school, sometimes I believe they need more information regarding child protection.
Definitely.
And of course it comes through your awareness and
definitely.
the campaigns. So what awareness programs has the Child Protection Office implemented to promote children's rights and being with children, protecting children?
Throughout the few years back, we are promoting for this awareness, of course, through our social media, through the Instagram, Twitter, but lately, which is since May 2024, we launched a campaign for, you know, increase awareness about the helpline, the child helpline 147, just to let people know that there is, you know, a system, and you can come in contact with that services through that line. And of course that come into multiple phases. The first phase was like through social media. We advertise about that line. It is actually with one of the you know, private sector. And the second phase was the awareness day, where we hold 2 days at the avenues, and we come, you know, the reach, actually it is more than 1,000 child.
Great interaction.
It was very nice. Of course, we deliver it like fun, rather than lecturing, or rather than, and through that, one of the important sectors, we educate children how to protect themselves and how to provide the special space, because this is very important to arm the child himself and to know what is the, you know, the good touch from the bad touch. This is very important to protect them from any harassment. And of course there is more about the health, the care, you know, prevention. Sometimes people, they reject to vaccinate the child. You know that child protection law, there is an article, there is a penalty for, you know, holding vaccination of the child, of course, immunization. So
it's applied.
Sorry?
It's applied.
Yes,
yeah.
of course. So this is important information we deliver through that. And we have entertainment, so they have a sport. We encourage for reading. We encourage for, you know, to be more creative, because, you know, children now, they're just holding a tablet or an iPad, and they spend more of their time. So we open a window that for the parents and for the children, that there is fun outside more than that iPad and tablet. So that was through the 2 days. And the last phase was just 2 weeks back. It is about school awareness, which is, again, it's very important. Community to be involved within for this, because, you know, most of the children, they're spending most of their time within the schools. So that we started it with the Desman bilingual, and there was 18 like schools, which just give them overview about what is the system and reporting, and we will have, inshallah, plan for going into schools for increase the awareness, educate the teachers and educators, and later educate the children. So still we have many to do.
Great plans, and it's really helping and to boost the awareness and also helping children expressing themselves.
Of course,
and knowing their rights
participation,
also.
child participation is very important. We want to know what he wants from us, what services he needed from us. I mean, sometimes adult thinking is different. So child participation, you are right, is very important, and it is one of the main principles that for anyone dealing with a child, to let him talk and listen to him and to be heard.
Yeah, and always there's a great role the Ministry of Interior is doing also when it comes to supporting campaigns like that. So we are wondering about the role of the Ministry of Interior's decree on the establishment of the Child Protection Division and also enhancing the child protection efforts.
Actually, that was really a great step taken to have a child protection department within the Ministry of Interior, and that's mirroring the Child Protection Office, because that makes things at ease, facilitate all the cases to go through a channel, open channel between the Ministry of Health and Ministry of Interior, where they could start the legal procedures within a short time. Because, you know, we can't leave the child for a long, you know, to do the whatever investigations or court or whatever. So that's really speed up the you know, steps or procedures and help the child to reach the services as early as possible.
Exactly. We're really thankful to you, Doctor, for the valuable information you're sharing with us this evening. And before we end this valuable interview and the valuable information you shared with us this evening, we would like to take an advice from your behalf to the parents and the caregivers and the guardians and the teachers who always communicate daily with children, and they are really responsible about the time, like the time the children spend with them.
Maybe before an advice, I would really mention about our prevention program, because it's very new. And it will be, you know, the first group of parents. They will receive the training on parenting, positive parenting.
Great news.
That will be, inshallah, in April and May.
Inshallah.
So the message I will give the parents, that involved in positive parenting through these programs. These programs being provided from the country. It is one of the a project that is now at the national level, and the aim of this project is to raise the skills of the parents toward a positive parenting rather than negative parenting. And actually we've noticed that more than 70% of the child maltreatment, it is because of negative parenting. So the parents did not know how to deal with these children, not about the developmental of age, of the sex, and of the, you know, the how to discipline these children. So this is actually my advice. Whenever that inshallah soon will be open, the registration. So please come and register to this prevention program, because it's really very helpful.
Definitely. We're really thankful to you, Doctor, for being this evening with us on Hala Kuwait, and we wish you the best of luck with your future endeavors, and we wish you enjoy the rest of Ramadan.
Thank you very much.
Thank you.
Thank
We're
you.
really thankful.
Pleasure.
The viewers, we just had with us Dr. Alkhawari, the Director of Child Protection Office at the Ministry of Health. Up next, we have a report we're going to share with you, then we'll be back. Stay with us.